Chapter 9, Monitoring System in Pre-analytical Processes. Topic: Need for a monitoring system in pre-analytical processes with examples of quality indicators. At the end of this training, learners should be able to understand the need for monitoring and evaluation in pre-analytical area, the procedure for developing quality indicators, and procedure for implementing quality indicators in pre-analytical processes. In order to maintain the quality of the pre-analytical processes, it is important that we observe and check the progress or the quality of the processes over a period of time, which is also known as monitoring. A monitoring and evaluation system should be in place to offer surveillance for management of pre-analytical services and adverse events, to plan quality objectives, the processes of continual improvement, and to document any improvement made. Now, as we draw close to the end of the sample collection module, learners are very well aware of the best practices involved in pre-analytical processes. To quickly recapitulate the best practices in pre-analytical processes, which include proper biomedical waste management, proper and smart disposal of sharps, proper phlebotomy technique. Therefore, to monitor pre-analytical processes, quality indicators include number and rate per month of sharps exposures, spills, and other occupational injuries among health workers, improper infection control and biomedical waste management practices, number and rate of patients per 100 with adverse events due to phlebotomy like hematoma, syncope, infection, or nerve damage, and number of reported cases of blood-borne pathogens transmitted during phlebotomy like hepatitis B, hepatitis C, and HIV. Other quality indicators may also include number and percentage of stocks out in sample collection, number and percentage of lab test results lost due to errors or poor quality, for example, contamination while collection of blood culture specimen, hemolysis and other sample rejection criteria, number of specimens with illegible or missing paperwork or labels, number of specimens not processed due to inadequate sample volumes, and number of samples rejected due to improper transportation. Since training is an important part of pre-analytical processes, monitoring the same is necessary through quality indicators like number and percentage of untrained staff working in phlebotomy, number and proportion of juniors not supervised by trained staff. Now that you have an understanding of quality indicators and its importance, how will you implement the same in your laboratory? To give an example, this is a bar diagram to represent the specimens rejected from September to December in a laboratory due to various sample rejection criteria like lack of identification, hemolysis, clot, and sample inadequacy. A bar chart, as you can see, helps us to visualize any quality indicator in a better way and thus provide a corrective and preventive action in a more effective manner. This is a bar diagram for occupational safety, which includes percentage needle stick injuries, percentage spills, no personal protective equipment, and improper biomedical waste management from the months September to December. One of the most significant quality indicators is patient satisfaction. Patient satisfaction is a measure of the extent to which the patient is content with the healthcare which they received from their healthcare provider. Factors which can add to the patient satisfaction are short waiting time due to small queues, a good turnaround time and provision of emergency services, a good waiting area with good utilities, courteous and pleasant laboratory staff adds to the patient's satisfaction. Good sample referral services, free service or reimbursement in case the patient is dissatisfied. Avoiding inefficient phlebotomy practices like multiple pricks or preventing complications like hematoma, syncope, infection or nerve damage due to good phlebotomy technique always add to patient satisfaction. Therefore, to summarize, monitoring non-conforming events or NCEs in a laboratory helps in providing the best results to the patient and overall patient satisfaction.